60 seconds guess the diagnosis, and as always, answer at the end. Let's go. Charlie is a 3-year-old child. He's been brought in by the mum and dad because they're worried about his walking. They say that they found him crying incessantly this morning. When they went to him, he seemed alright and did settle pretty quickly. To encourage him to stop crying, they got him up to play. They say that he looked okay, but within a few moments, he was really struggling to walk. He toppled forward and fell onto the carpet. They say he didn't sustain any significant injury. They picked him up gently, calmed him down, and since then they've noticed that he's hobbling. They say that his knee is bent and he's not straightening it. When they do straighten his leg, he's walking with the foot facing outwards. This happened for a few steps, and now he refuses to walk. They say that when they encourage for him to stand on both legs, it's as if he can't weight bear or put any weight through that leg. Worried, they bring him to see you. You're informed that the observations look normal. The child's clutching to the mother. He's not walking, and the nursing team have noted in the A&E reception he's been sat on her lap. The mother tells you this is abnormal for him. He's normally running around, playing and very active. You get him to stand up and walk, and you notice that things are slightly better since a few hours ago, but he's still hobbling and has a limp. You try some pain relief and the symptoms get better. The limp is still present, so you do an x-ray. If I tell you this shows no acute fractures, and the parents confirm that he's been well over the last week, he's not fallen over. They say that they gave him some Calpol 4 or 5 days ago. They thought he was teething, and he had a gentle cough. Again, they thought that's because the teeth were coming through. If I tell you this is fairly common between 3 and 10-year-olds, it's a leading cause of an acute limp or leg pain. There are other more serious things to consider when working up these patients, but it's thought in this condition this is due to an infection, as the body mounts a response against this. It can also cause inflammation within our body. All of the joints in our skeleton have a liquid sac around them that lubricates it. It makes sure that they don't rub against one another. Sometimes there's inflammation and swelling of this lining or fluid. This causes exquisite tenderness for children. These symptoms should settle in a few days and the child's back to normal. If I tell you, you reassure the parents that you think it's a benign cause, but if it doesn't get better or even starts to worsen over the next couple of days to re-attend and you book to see him in a few days' time, the mum looks at you and says, "Doc, what do you think's going on?" Correct, this is toxic synovitis.